Hello and welcome to the Health Evolution Collective. Today I am here with Dr. Herath. Thank you so much for joining me on the podcast today. I'm really looking forward to chatting with you.
Oh, absolute pleasure to be with you.
Well, thank you so much. So I first came across you when I started Low Carb Melbourne, and you were one of the doctors that joined the group through, I believe, Avi Charlton.
Yes, absolutely.
Yes, so I would really love to know, obviously, a little bit about you, where you work around Melbourne and what type of medicine you practice.
Sure. Look, I'm at the most simply said, just your basic GP at a suburban level. But having said that, these days GPs are very different in what they actually do. So I'm in southeastern Melbourne, so my background is that I did my undergraduate degree in cell biology in the US, in Kansas, University of Kansas, and did medicine at Flinders University in Adelaide. And I've been a GP for about 15 years now, almost 15 years. And I work at two different locations. So I'm one of the partner owners of both clinics. And so it's a wide area, very diverse socioeconomic, cultural backgrounds. So yes, we do the see patients from the age of 0 to 110. I think my oldest patient is 106 actually. So
really, that's awesome.
Yeah, absolutely. So we see all the usual things that you would expect in general practice, but certainly, low carb eating and living is my interest, and so that's been an interest for about 4 or 5 years now. And yes, so that's how I ended up in the community, so to speak.
Awesome. So what I've really gleaned, I mean, certainly for me personally, and a lot of the people that I talk to in the space, there's been some sort of personal, health journey or something that's happened that's kind of led us down the path of low carb. Was there something like that for you as well?
Certainly. Look, everybody has their kind of story, don't they? And there's similarities in the stories. Most people start out with having a battle with their weight, or when they're diagnosed with elevated blood sugars or diabetes. In my case, look, I've been struggling with weight my entire life, since I was a teenager, essentially. And as with everybody else, I've gone through the whole rigmarole of diets and pills and all those type of things. So probably anybody that sounds familiar, my story is probably about the exact same as everybody else's. I guess for me, the big change was when I actually caught up with once Facebook came online and everybody was, connecting with people from their, I guess, childhood and, time in high school and university. So I connected with a friend of mine who was also my flatmate at university. And so this was a guy who was quite, he was unhealthy in the way that he lived, but he made this massive transformation in his life. And I said, wow, how did you do that? And so it just turned out that he was basically on a carnivore diet. And so that, just as a GP with conventional training and education, that floored me. I said, how can you possibly do that? You're going to die. And so at that stage, a conversation started, and all of a sudden you start to read a little bit and going, well, how can you be healthy yet be eating all this saturated fat? And this just doesn't make sense. And with anything in life, when it doesn't make sense, you just kind of, at first you're stunned, shocked, disbelief, and then you start to kind of go, well, what's going on here? And that little bit of curiosity, I suppose, led to reading a couple of books. So as it's the same story as everybody else's, and then all of a sudden you start to go down this bit of a rabbit hole, and as everybody knows, and you go, oh wow, what I've been taught and what I believed is not actually true. And then the more that you see that, the more you kind of question a lot of aspects of conventional medicine and what we've been taught. Having said that, you do come back to some, I guess, fundamentals in how medicine is practiced and the knowledge base. But yeah, it's been an amazing journey in terms of just learning new things. So, it's one of those areas where it just seems to be growing every single day, and plenty of people with plenty of opinions, a lot of conflict in those opinions. But I think that's healthy, and that's where I'm at the moment.
That's really exciting. So are you carnivore, or did you sort of just adopt a low carb or ketogenic lifestyle? How does it look for you at the moment?
So for me, look, I think I've been on and off for about 5 years. So there was this, I guess, this moment where I went, okay, I'm going to do this. I'm going to go low carbohydrate. And I actually just went on a low carbohydrate diet, which I defined for myself as 50 grams of carbohydrate or less per day. And I had almost immediate results. And of course, you see that massive drop in weight in about a week, and you go, oh my goodness, what's actually happening here? What's the physiology here? And so that went on for a little while. And, the stories are so similar because, I see it with my patients now as well, which is, 2-3 weeks into this, you're screaming from the rooftops, aren't you? Going, oh my God, I found the Holy Grail. I feel great. And, I'm losing weight and my life's never going to be the same. And so that's exactly where I was as well. And so I actually had a reasonable success in terms of losing weight. But then it was interesting how, the steam kind of goes out a little bit. And I think a lot of people find that same situation. And then you understand how valuable, for example, community is with this type of thing. But anyway, so, the weight came back on. And then once again, I went, okay, well, you get that click again, and you want to do something. And all of a sudden I was doing it again. And this time it was maybe a little bit different. And then it all helped. And then once again, life changes. And then you learn a little bit more. You go back and forth and back and forth. And so it's interesting. This last, the most recent, I guess, incarnation of how I eat and how I live is only about a month old now. And the reason, and I would say that I'm about 90% carnivore. So really, now that I understand how it works, now that I know what the the initial, I guess I can't call it side effects. It's certainly not a drug, but the initial adverse feelings and physiological changes, you get used to it and you know what to expect. So certainly this time around, I went in coming from a place of COVID lockdown and COVID kilos, so to speak. I certainly wasn't. I was still overweight when COVID hit, so I was just more overweight, about 6-7 kilos up over that time. And I just wanted to mainly get down to where I could fit back into my clothes again, really. And I've actually kind of achieved that. That's actually happened just within about the last month. As you know, that's exactly what happens. But this time around, yes, I did this 2 weeks of basically bacon and eggs for lunch and steak for dinner and water. And that's it.
Yum.
And I did that for two solid weeks. And I went through everything that I knew that I would go through, whether you want to call it the keto flu or whatever. The issues were not unexpected, so it was much easier to deal with. I certainly had issues with things like insomnia. That's always a big thing. But, I already knew what was going to happen, so I kind of took some measures there. Once again, knowing the right GP and me having my own GP and speaking to him about exactly what I was doing, and he's once again supportive as well. Well, ish. But I said I didn't want to deal with the insomnia, so certainly we talked about how we could help that, and so that I managed that. And once I came through with it, now I sleep without any need for anything at all, and now life is kind of back to normal, except I'm still continuing on with a low carbohydrate diet. So I went those 2 weeks, which were pretty much strict carnivore, to now I would say 90% carnivore. So look, I'll have a little bit here and there of salads and greens and things like that, just almost as a garnish, really, more than anything else, and to take away the boredom. But really, the protein is basically the base of my eating, I suppose. And so that's where I'm at the moment. And look, I don't weigh myself all the time. I don't like that. I don't actually advocate it. I weigh myself once every 2 weeks on the same day. So the first time I weighed myself, I was 3.5 kilos down after 2 weeks. And the next time I actually weighed myself will be actually this week. So I don't know yet, but I can tell it's come off. So
yeah, and you just feel it. I mean, it's the scales are, I suppose, just a nice byproduct, but you really just feel it in yourself, don't you?
Absolutely. And the other thing I can, now, once again, because I've gone through this again a few times, this time was a bit different, actually, which was that I kind of really hit a low point. I felt like, I need to either get on this train and stay on it for good. I had to do a lot of soul searching, and also looking at why, I couldn't sustain this type of eating and a lifestyle. And I kind of this time identified some other issues that were coming up, and it's very, very important to take a very holistic approach to this. It's not just about the food. And I think when you realize that, and it takes a few goes, I know with people who quit smoking, they might quit a few times, but every time, as long as you're trying, you're not failing. And every time you get back onto it, with some additional information, you just get stronger. So this time around, I identified, some of the negative things that were in my life that actually were stopping me. So this time around, I'm thinking it's a bit different, and I kind of feel very strong in myself.
I'm so curious about that, because it's certainly what I've seen, and certainly in my job as a health coach, I would say never, but rarely is the conversations I have with my clients around the food. It is so around a lot of the things that you've identified, because I think, we don't know what we don't know, right? So we come in with a whole lot of thinking around what, diet should look like. And, my clients are mostly women. So, there's a huge amount of dieting that's gone on, and restricting and all this stuff. And I've just seen, over this time, it's so important to address those if we do want sustained change, because I think you're so right. I think it's often a few attempts, and I actually say now that's normal. That's what most normal people will do. Is nothing. It doesn't mean you've failed. It just means that maybe there's more to see. There's a few things that need addressing. But really, welcome to human beinghood, because that's pretty much how most of us do it.
Yeah, and I actually find it refreshing, because I think most people are of this idea that, this whole diet idea, which is you start a diet, you read something, they tell you what to do, you follow that, your weight is supposed to come off linearly, and if you fail at that, then you failed. This is not the right diet for you. Go find something else. And they talk about the diet, and they talk about the food, and ultimately, it's actually a setup for failure. And I really resent that in some of the even from what medical doctors have actually pushed along the way, because it is setting people up for failure, because they don't actually learn anything from it. They actually end up just feeling defeated, demoralized, and then their next attempt is actually coming from a place of failure. I don't like that. So I actually think that this way of living, the more that you incorporate your environment, who your friends are, what you do for fun, where do you go out, what do you eat, what activities do you engage in, what is your religious background, what are the festivities that you actually engage in. All of this needs to be considered. And if you're serious about this, it's about health, isn't it? So if you're serious about this, then you're willing to make some hard decisions. And I think that's what's actually happened to me. And I think that's what I see in my patients as well. The ones who are successful have really, I've had a patient tell me that they may, when the penny dropped was when they were in a hospital bed and they couldn't move because of a chronic inflammatory condition. And that's when everything changed for this particular person. But then I've also had people who've just had, they've just woken up one day and said, no, I can't live like this. I see myself in 3 years and I wonder what I'm going to be like. Am I going to be heavier? Am I going to be sicker? Am I going to be more resentful of society and all the, I guess, negativity that comes with being overweight and unhealthy? And that's enough. So different triggers for different people, but I think it's more in the process than actually the food and the goal. When you realize that the process is what you need to work on, then you can almost throw the scales out because the scales are just a number. At the end of the day, if you're doing the right thing and you're treating your body the way it should be treated, then all the benefits will come without you even, having to measure it or monitor it.
Yeah. And I think the interesting thing about that I've certainly seen too is that that's such an internal process. I mean, you would see this, I would imagine, with patients that you might present this to. If they're not willing to address it or to look there or see it, we will tell ourselves anything to I guess stay in that discomfort of at least known discomfort rather than go down the path of the unknown with change. So I just think, from what you've just shared, I mean, the layer that you then bring to your patients must be amazing. But how do you deal with, patients that come to see you? Is this something that you offer as a standard? And then, for people that aren't interested, how do you kind of handle that?
Okay, well, it has to be brought to the table at some point. And I think these days, even going back 5 years ago, I'd see somebody who's overweight and I'd go, well, they're just overweight. Big deal. They're a bit fat, but you can be fit and fat, can't you? Yeah. And then I started to think, well, actually, no. Just having all these engorged fat cells in your body, they're actually making you sick. It's actually and it's not just the physical, it's also the mental as well. People start to think very differently when they can't, fit into a chair or button up their trousers, or, they see themselves in the mirror. So there's a mental component to this as well. Often what I find is that, somebody will come in and they might be coming in with, I don't know, gout of their big toe or something like that. And almost always I can relate the majority of illnesses and acute presentations to diet somehow. You get people who come in with osteoarthritis of the knees and they're complaining of knee pain. Well, one of the first things that you want to do is to take some weight off and take the pressure off those knees, so you can relate it back to diet. Even that example of gout. Okay, so here we go. We can talk about diet again. So almost every single presentation has an opportunity. There's a window there to speak about food. And along the way, yes, weight comes into it as well. So there is, I think, this idea that illness and health are very separate to diet, and they're not. They're pretty much part and parcel of everything. Yeah. So everything from any kid showing up with a rash, let's look at your diet. So these things do. It's not as much of a stretch anymore. And I think with certain practitioners like us who are interested in diet and food, we're good at it. So I take every opportunity. Sometimes it's very, if you're meeting somebody for the very first time, it can be very confronting. You certainly don't want to make them feel bad for their BMI or their body shape, or But certainly, if you do develop a rapport and you can convey to them that it is in their best interest to do something about their body fat, then I think most people are engaging, and they're just waiting to be asked. You know, we have such a thing in society where, you know, geez, you shouldn't say anything. You know, you shouldn't ask
Yeah.
anything. But I mean, that's the brilliant thing about being a GP, is that when somebody comes in through those doors and you close the door, you're there for them, and that's it. And there's a sacred relationship that goes beyond two people in a room. This is a doctor-patient relationship that goes back thousands of years, thousands and thousands. And there's inherent trust that, you know, it's been developed over so many generations, through so many skilled physicians, through so many compassionate and caring physicians, that you can take advantage of that to promote people's health. So I always, you know, when I do my teaching, I tell my registrars, you know, you're in such a privileged position. You know, you can never have met somebody ever, and they come in through your front, you know, through your office door. You close the door, you sit down, and within 2 minutes, you can be looking at some of the most private parts of their body and examining and asking some of the most, intrusive questions. But the reason you can do that is because of what has come before you, the doctor-patient relationship. So it actually isn't that hard of a stretch to talk to patients about their weight and healthy lifestyle as well. So I don't actually find it too confronting, and the more you do it as well, and I hope other GPs do that as well, the more you get better at it. And it is holistic care, isn't it? If you're actually
Yeah.
looking at what people do at home and how they eat and how they live. So yeah.
Mm. And I think most of the patients that hear that from you will probably relieve that for the first time they're not being told to just eat less and move more, and it's, you know, looked on as though it's their fault that, you know, they are where they are.
Yeah. Well, the thing is that, you know, you have to have a plan if you're going to ask these people questions. You have to have an idea about what you're going to do. And it has to be more than eat less and move more, because that's, you know, you might as well not say anything then. And that's, I think, part of the problem is that most GPs actually find that, you know, it's a bit confronting and like, oh, do I want to actually give you another script to help you lose weight? Is that, and I think the majority of GPs out there are, you know, contrary to popular belief, I believe, they're not pill pushers. They just want to give options, and the options that they're given are often pharmacological. So there's always a new pill every year, or a new injection, or a new thing. And certainly, I found, at least my experience before I kind of looked into low carb, was I just felt, you know, you almost don't want to bring up that issue. So if somebody's coming in with a sore toe, you just want to deal with the sore toe, and then everybody's more or less happy. It's not great. It's not holistic. It's not, you know, addressing other issues. And it's probably poor medicine, but, you know, you dealt with the sore toe. So there you go. But now that you do have options, and especially with a low carbohydrate, I like the term low carb, because it encompasses carnivore. You know, you can not eat meat if you don't want to. You can intermittent fast. You can do all these different variations. So it does give a huge breadth of options for patients, and we know it works because it works. And and I think the concerns about safety are now allayed to most people, and even GPs who don't really know much about low carb are not getting on this. I think they're aware that, you know, people aren't dying because they're going onto a ketogenic diet. They know that because it just doesn't happen. You know, it's ultimately the numbers have been proved over and over again. Now we have enough evidence to say that this is healthy, supervised, right? And I think engaging with your GP is a good thing, but the majority of them are happy for that to happen as well. So the ones that, people like me who actually advocate it and actually promote it, we feel a bit more supported and not out in the ostracized from the rest of the medical community either. So, which is a good thing.
That is a good thing. It's changed a lot. I mean, I've been personally in the space for 8 years. My ex-husband is a doctor, and even he has gone from, I've watched him go from being completely, how ridiculous, to, oh yeah, this is very interesting, and open to it. And it's almost like it is a lot more commonplace now. But I'm wondering what you think about, because what Gary Fettke went through when he, promoted, eating real food to his patients. Do you think that something has to change with the guidelines for, in that, doctors need to know, categorically that they won't get into trouble for recommending a low carb diet?
Well, it's interesting about Gary Fettke, because I heard him speak, and he speaking to a bunch of doctors, and he basically said, look, I went through this so that you don't have to. And if anybody comes after you, why don't you give me a call? Because it's almost like we have something, a prepared defense for you. And I don't feel that that's necessary. I mean, it's wonderful of Gary to say that, but it's probably not necessary these days, because I think what the issue that GPs face and most doctors face is if they're doing something that they're not sure about. So that puts them in the firing line if they're not sure about the safety and efficacy and indications for doing something. If you're confident, and if you know that this is going to help your patient, it's not going to land them in hospital, it's not going to be something awful happen to them, then I don't really fear that as much. Now, are the health authorities going to come after me? Well, probably not, because I think we still operate within the boundaries of monitoring people's health, doing their blood tests, checking their blood pressure, making sure we're doing anything and everything possible to keep them healthy. And so look, diet forms a very interesting part of the medical equation, because it's not the advice that we tend to give, at least I tend to give, is very generalized. So it's not prescriptive eating, it is generalized eating, and it is basically saying you need to make this fit into your lifestyle. I'm not one to say, okay, guys, everybody, all right, you're going to have six eggs and 15 rashers of bacon for lunch, and then you're going to have 2 sirloin steaks for dinner, and that's what everybody's going to do. No, it doesn't work like that. It is actually going to be tailored to the individual. So it is not, I'm not prescribing a pharmacological measure, the same pharmacological measure over and over again. It is tailored to them. And often it is taking into account, their individual circumstances. So I don't think you can actually come across, prosecute a case saying, well, you're doing the wrong thing as a practitioner, unless, of course, the patient is not on board with you. And of course, I wouldn't be pushing anything where a patient is not on board or it doesn't see the benefit of that for them. So I don't think I'm as worried about this anymore. And I don't think the health authorities are coming after GPs as they once thought they would, so to speak.
Yeah, which is good. So interesting though, what do you think about, I guess, the knowledge? Because even, we sit in, well, I've certainly sat in this space for a long time, and, you just step one foot out and you realize that, no, actually there's still a lot of people that don't even know about this, and if, or not even think it's a fad, and, what have you. And then, of course, even yesterday, just a lady in Low Carb Melbourne posted, she was someone new to the group, she posted how a doctor just told her to eat margarine and have no more than 1 or 2 eggs a day. There's still so much. And that was from her doctor. And, I mean, how do we, is it personal choice, for a doctor to want to take this on and learn about it?
Sure. It is it's a personal choice. And the thing about it is that, all GPs aren't the same. And there's such things as guidelines, but at the same time, there's also a bit of variability in terms of what we can actually practice, because we have to suit those guidelines to the individual patient. Certain doctors who are not interested in this space are going to stick to some very basic principles, and they're just going to go with what they knew in 1984, and they're going to stick with it because it hasn't it hasn't worked, maybe, but at the same time, if it hasn't done any harm and it hasn't come back to bite them, they probably feel that it's okay. If you find that you're not happy with what you're being told in terms of diet and lifestyle, I think everybody deserves a second opinion. So you can always go and have a chat to people, especially doctors who have an interest in certainly have an interest in diet and lifestyle. So, and these days, especially because we have all the internet groups and Facebook groups and whatnot, it's not too hard to find somebody.
That's right. That's right. Well, I was hoping you talked about in the beginning how, when you first came across this, you had a friend who went carnivore and lost all this weight, and, you kind of went, what, you're going to kill yourself with all this saturated fat and, eating all this meat and what have you. So I was hoping you kind of, because obviously it's still very much, common thought out there that yes, saturated fat is going to cause heart disease, and we should avoid it at all costs. So what do you say if I was your patient and you said that, don't worry about meat, saturated fat's fine, and I said to you, oh, but isn't it going to kill me? How would you answer that?
Well, look, I still base my cardiovascular risk assessment based on the cardiovascular risk guidelines. However, where saturated fat and especially cholesterol fit into that, that's the area that's actually changing. So, there used to be a emphasis on total cholesterol, and there used to be a big emphasis on LDL cholesterol. And I think, after somebody's actually had a heart attack or a stroke, certainly I would still be very hesitant about, going on to a low carbohydrate diet, which included a lot of saturated fat, unless I had some agreement or at least some advice from their treating cardiologist. But beforehand, what I have found is that the bigger risk factors in terms of cardiovascular disease, things like high blood pressure, certainly high blood sugar and diabetes, they seem to weigh much more heavily than cholesterol. And that's kind of what I tell patients, because if you actually look at the risk charts, where cholesterol fits in, especially total cholesterol to good cholesterol, HDL, which is what determines your cardiovascular risk factors, or cardiovascular risk profile, it's actually quite generous. So as long as we're monitoring people in terms of, look, you get your cholesterol done, and if necessary, we can do subfractions to make sure that, you're in the right kind of profile and you're not at an increased risk. You can get coronary artery calcium scores done, or also, or even a CT angiogram done if there's a lot of concern. So right now we have a lot of modalities to allay fears and to really say, well, look, your true risk is actually quite low. Interestingly, now people lose weight. One of the most interesting observations that I've had is that people's blood pressure improves, and that seems to be a massive reduction in risk factor. So, they go on to this, high saturated fat diet. They lose all this fluid out of their system, right, in the first couple of weeks, and all of a sudden their blood pressure drops. So I'm taking people off of their blood pressure medication, which is a very, very common thing, and this is the only intervention in my medical career where I've actually had to take people off of medication because their lifestyle has made a huge difference. So, and lo and behold, their HbA1c start to drop. Now, we're taking away another risk factor. So if we're looking at this in a holistic way and looking at overall cardiovascular risk, and you're improving blood pressure, improving HbA1cs, and reducing the inflammatory effects of sugar on the blood vessels, then even you actually can tolerate a little bit higher total cholesterol without and still be coming in much better in terms of a cardiovascular risk profile. So to answer your question, what most patients want is to hear that. To hear that they're going to be monitored, that they're going to be looked after, that there are going to be some added benefits. So you're actually going to lose, your blood pressure is going to go down, you're going to lose weight, and your sugar control is going to get better. And that in itself is actually going to improve your heart health and your risk of cardiovascular disease. So this is a very, there's nothing that says that is going to take your absolute risk down to zero. But patients are reassured when you actually take the time to explain that to them. And that's the big thing about practicing low carb medicine. I think you just have to take the time to explain yourself to the patient and advise them exactly what you're doing and come to a plan that both of you agree. Medicine is no longer top down. We don't tell patients what to do and they do it or they don't. It's actually a negotiation, and patients are very well informed these days. So, often they appreciate that. So I run into this problem of carnivore and people asking me about bowel cancer. So then I said, well, being overweight increases your risk of bowel cancer too, and other cancers, and heart disease, and sleep apnea, so traffic accidents and everything else, right? So everything's a give and take. So to say that you have one thing that's going to fix everything is wrong, and to also say doing just the stock standard conventional way of managing disease is also not necessarily the right thing for everybody.
Oh, lovely. I'd be very happy with that answer if I was your patient. I was going to ask you, and I realise that I have to let you go, but just quickly, who are some of the people that you really respect and learn from in the field? Like, have you got favourite podcasts or books that you recommend, or people that you listen to learn from? Because I think it's just for me, it's kind of like it's a never-ending learning journey. There's always things that we can learn and see, and interested in who you listen to.
At the end of the day, I think I do a lot more reading than actually listening to podcasts. I'm sorry. I am sorry.
You have to listen to this one.
It's one of those things that it's a time thing, and my drives are short, unfortunately, so I don't tend to listen to much in the car. But look, I mean, of Jason Fung, Finney Volek, the gurus of ketogenic and low carb. That's who I kind of think about. Now the space is very saturated with a lot of people with such great ideas and such diversity of ideas that to say, well, this person's book changed my life, or this is what really made the penny drop for me. It's very hard to say. I mean, I don't even know who I'm quoting or where this information is coming from, because you read bits and pieces, and I reckon getting involved in the community is probably the most important thing. I do. Peter Bruckner's book is what I kind of recommend to my patients, because I find that it's a good starting point. And look, people know who he is, right? And I think that gives a little bit of gets people kind of going, oh, okay, all right. So there's people that actually, somebody that I know or have heard of that actually advocates this. I think it gets people reading something useful and starting the conversation and starting the exploration. And it is one of starting, trying, maybe failing, or taking a backward step, not failing, backward step, and then starting again and figuring it out along the way. And of course, if they engage with a health coach, with their GP to get their bloods done and to keep an eye over everything, because that's the other thing that we can do is to take it to the next level if necessary, to get a specialist opinion, for example. And of course, there's a growing number of low carb specialists as well, which is great to see. So there's more people coming on board than leaving. Let's put it that way. I don't know anybody's leaving the arena. So, but yes, there's no specific person that I can actually say, well, this is who I follow as a guru. Everybody's made so much contribution into the space, and it's appreciated by the likes of me.
That's fantastic. Well, lastly, can you just quickly you've given lots of insight for people that are on the fence. I think, my sort of hope is that I just get people curious enough to give it a go and to try with the stuff that I share. And, you know, I'd love just to get, you know, what would be some bits of advice that you could give to anyone that's sitting there on the fence, if you like, you know,
Yep.
willing to, what do you think you could say that could help them take that first step?
Look, I think the most important thing is a mentor, and I really think that that's the, you know, whether it's a health coach or whether it's a GP or somebody, you need to have somebody who's going to hold your hand a little bit. Okay, you go on to things, you know, look, there's some great Facebook groups and there's some great community things out there, and some great paid programs and things like that as well. But you need somebody who's already been there and who's already who advocates, and I think that just makes it easier. Makes it easier. It makes it more fun too. Maybe you know, when you know. I just remember at the beginning when I started, I was getting more feedback. I was actually getting just as much out of my patients for myself as I was giving to patients as well, because they'd come in and say, "Hey, doc, what about this fat bomb recipe?" You know, all of a sudden there's this fat bomb craze for about, you know, 3 months of my life. And then all of a sudden, okay. So you get past that. But the reality is that, you know, if you're doing it with a friend or somebody that you trust or a health coach or an advisor, that's the start. So find somebody, and you don't have to look too far these days to find somebody, even if it's not somebody that you know. Yes, there's plenty of advocates and people that will hold your hand, give you that little bit of confidence, because this is if you're coming into this new, it's a brand new arena. Nobody knows about it. So yeah, and it's going to blow your mind when people say, well, you know, eat lots of bacon, you know, or eat lots of eggs, you know. It just defies conventional principles if that's what you're coming into it with.
Yeah, absolutely. Oh, well, such a pleasure to talk to you today. Thank you so much for taking the time to chat with me in your car. I love it. I can see it's raining.
It's raining. Rain's pouring all around me, but that's you know, we need it. We always need rain.
We do, and I'm obviously going to have all the, you know, the ways people can connect with you if they're interested in connecting with you. But I really appreciate your time. It was such a great conversation. Thank you so much.
Oh, great to speak with you, Tracy, and it's a pleasure to be on.
Thank you.
All right.